Today, we're doing pregnancy exercises that are great to do daily to prepare for the easiest possible vaginal delivery or normal delivery. I had 3 positive birth experiences using these exact exercises, and I have literally heard hundreds of positive experiences where mothers have had these beautiful, positive births after using these exercises. We're gonna work on preparing our body, we're gonna open up our hips, get baby into the optimal fetal position, and we're also gonna prepare our mind. I am going to use a birth ball for the first few exercises, but if you don't have one, I'm going to give modifications so you can do it without. We can either start on our ball or you can sit on the ground or a chair. Let's take some side bends. Really ballooning out through our side body, making room for baby. Exhale, coming up. Just moving side to side. Good. We can clasp our elbows or our hands behind us, keeping our ribs pulled down, opening up through our chest. Slowly releasing our hands, rounding out the other way. One last time. Exhale, release, rounding out. Gently release. If you don't have your ball, you can make your way to all fours. We'll take some hip circles, lubricating all the joints. Going the other way. We'll move into a figure 8 motion now. Good. Now moving our hips side to side. Forward and back. Last one. Good. Let's sit tall, let our spine be neutral. We're gonna take a 360 breath, meaning we're gonna breathe in 360 degrees all around our ribs, letting our side and back ribs expand, and then exhale, hugging your baby in tight to your spine. Your belly should move in. Inhale, breathing into your ribs. This is gonna protect your core and your linea alba from when you breathe deeply into your belly and it expands, that puts more tension on your abdominal muscles. So we want to breathe into our ribs. Exhale. Inhale. Exhale. Good. And let's let our pelvic floor melt into the ball or into the ground if we're sitting on the ground. So your uterus is going to push out your baby, and your pelvic floor just simply has to move aside and relax. Of course, it's good pelvic floor exercises for recovery after and to stopping any leaking during pregnancy, but really for birth, we just want to focus on relaxing and imagining your pelvic floor just melting. So we're going to use our 360 breath through our exercises. I'm going to turn to the side here now. And if you're feeling unstable on your ball, you can hold onto a wall. And if you don't have your ball, we're going to do these exercises standing up. But we're going to exhale, pull your baby in, extend, inhale into your side and back ribs down, switching legs. Moving with your breath. Focusing on the core work as you lift your leg. Last one. Good. Let's come up off our ball. We're gonna pick our ball up now. If you don't have a ball, you can just do it without the ball in our hands. We're gonna squat down as we lift the ball overhead and then coming up, sitting right back into your hips. Exhale, pull your baby in. Inhale, coming up. Last one. Good. Let's come to a lunge position here. And as we come up, we're going to reach the ball forward, coming back into a lunge. Squeezing your legs at the top. Last one. Good. Step together. We can switch to the other side. Coming down into your lunge. Exhale up. Hugging your baby in. Last one. Good. Step together. Let's put our ball on the ground now, bringing our feet wide apart. We're gonna sumo squat down. You can roll the ball out as you come into a deep sumo squat here, and then come up. We're not gonna come up all the way, only as far as your fingertips can go, and then coming back down again. Nice deep squat. Beautiful. Coming up. Nice and slow. Letting your hips open. Keeping your baby hugged into your spine. On this next one, we're gonna hold down here, breathe through it. This doesn't feel unsimilar to a contraction. Release out, beautiful job. Let's shake it out. We can come down onto all fours, or you can lean over the ball. Let's do some pelvic tilts here. Exhale, tucking your tailbone under. Inhale, tilting it up. Good. We can take one leg in front for a lunge. This pose is also great to do during your labor. Releasing through your hips here. Move back and forth a little bit. Switching to the other side. You can also rest over the ball here if it feels good. Adding a little bit of movement back and forth now. Good, pressing into your front foot, come on up. You can put your ball away, we can grab a sip of water now. Let's make our way to all fours now, moving into bird dog. We're gonna exhale, lift opposite leg and arm, keeping your baby hugged in tight. Inhale, release down, switching sides. Inhale, down, moving with your own breath. Last one. Tucking our toes, we're gonna move into a bear hover. Again, hugging in your baby. Exhale as you lift off your knees, keeping your knees as low as possible. Breathing into your side and back ribs. Release down, big breath in. Exhale, lift again. Good, releasing down, take a breath. One last time. Releasing it down, good. Let's stretch out one leg behind, stretching through the calf. If you're having leg cramps at night, this can be really helpful. Heel reaching away. Good. Let's move to the other side. Gently come back in. We're gonna move into puppy pose here, keeping our hips high in the air. You can walk your hands forward. You can also place your head on a pillow if it's more comfortable. This is a great position for optimal fetal positioning. Breathe here. Keeping your back strong, not dumping into your lower back. Good. When you're ready, you can walk your hands back in again. We're going to come to a seated position for figure 4 stretch. Alternatively, you could also do this on a chair. Crossing one ankle over, keeping this foot on the top flexed. Keeping length in your spine. Releasing through your hips. You can also take your hand and place it just above your knee for a deeper stretch. Relaxing through your pelvic floor. Gently releasing on this side, we'll switch to the other side. Slowly release. We can plant our feet on the ground. Fingertips are pointing towards our feet. Exhale, pull your baby in. Using your glutes, lift up, coming down again. Good. Exhale, lift, inhale, down. Good, release it down. We can round out. Let's make our way down onto our sides, keeping your baby pulled in as you switch positions. It may be more comfy to put a wedge or a little blanket or pillow underneath your belly. We want to stack our hips and almost imagine lifting off. You may not actually be able to lift off, but keeping your core engaged enough to lift through your lower side body there. Let's extend our top leg out. We're gonna lift and lower. One more here. Good. Reach it out, and we'll do circles about the size of a basketball. Keeping our hips very stable so they're not rocking back and forth. Continuing to pull your baby in towards your spine, engaging your core. Switching directions. Good. Release down, take a breath. Now we're going to practice our inner rotation, bringing our ankle up, knees together, and then moving into a clamshell, moving back and forth. This is great practice for pushing when we want to use our internal rotation when we're feeling our baby crowning. Good, last one here. Release down. We can bring our top leg over. You can bring your foot down or just cross your knee over. We're gonna work on our adductors or inner thighs. Lift 2, lower 2. Re-engaging your core if you need to. Lift it up and hold here. Release down. Good. We can bend our bottom leg again. Let's do a couple circles with our knee, just opening up our hips again. We can grab onto our ankle for a gentle quad stretch. Beautiful. Release. We can make our way onto the other side, or you can just roll over. Again, taking any time that you need to put a wedge or a blanket underneath your belly. We'll get ready to lift. Exhale, re-engaging your core. Lift. Good. Moving into our circles. Switching directions. Releasing down, good, taking a breath. Internal rotation here, so you can see how you could even push on your side, putting your ankle up over a peanut ball, even if you can't be in all fours or an upright position. and then opening up to clamshell. Last one, good. We can cross our foot or our knee over, up 2, down 2. Lift and hold, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release. Amazing. Bending your bottom leg, circling your knee. Moving into your quad stretch. Good. Gently release. Let's relax onto the ground. We can imagine that we're in early labor, and you're going to turn your attention inwards for your contraction with slow, controlled breaths. I found it helpful to use sort of a throat restriction or Darth Vader breath, so as if you're trying to fog up a window, but your mouth is closed. So you can hear it, it's calming, it's meditative. You're breathing in and out. You're relaxing your jaw, you're relaxing your pelvic floor. You can also use low toned vowel sounds or even moaning, like wherever you are relaxed and you're controlled. We can slowly push our way back up to a seated position. Let's take a one-legged, wide-legged stretch. Stretching up and over. Exhale. Let's switch to the other side. Exhale, coming up. You did amazing. I hope that you're feeling strong and that you're feeling confident after that class. Your body intuitively knows how to birth your baby, and we just need to relax, breathe, and learn to work with our body. Research shows that when women are left to choose their birthing position, they will choose a birthing position upright, either on all fours or squatting, which allows movement of their sacrum and the use of gravity to birth their babies. What our bodies can do is absolutely amazing. If you wanted to learn more, I'm gonna link to my ebook on how to reduce and cope with pain during labor in the description box below. I'm also gonna link to my video on 15 steps on how to have an easy labor. Thank you so much for joining me today. I will keep putting out new pregnancy workouts and birth education every week. If you enjoy videos like these and to support me, subscribe and hit the notification bell.